First and foremost, before I begin, what I'd like to do is introduce what I believe is some of the finest Health and Human Service team members in the state of New York. And so let's start with Ken Cronell, Deputy County Executive, who oversees Health and Human Services for my administration. Dr. Carol Smith, Commissioner of Health and Mental Health. Mike Iapoce, the Commissioner of Social Services. Cheryl Kumar, the Deputy Commissioner of Mental Health. Ann Cardinelli, the Director of OFA. And Evelyn Clark, who does double duty for us as the Youth Director as well as the Director of Human Rights. What we're here to talk about today is something called the Ulster Cares Initiative. But before we do, I think it's important that we really discuss the new financial paradigm that is facing all governments in New York State. And that paradigm consists of this: very limited resources needed to provide services where the demand is expanding. And how to do that in an environment that brings forward real crisis in some instances, but also a scenario in which we can do profound good. And so that's what we're going to talk about today, how we deal with that. There are two kinds of governments when it comes to dealing with this kind of financial paradigm facing all counties. Kinds that are reactive and simply wait to respond. So we're clear, those types of governments suffer under these two major challenges afterwards. They suffer from their taxpayers are negatively impacted because they run out of money. Bond ratings suffer. And there's a major negative impact. But there is another just as important, if not more important issue, and that is services suffer. People in need are not receiving the access to care in those kinds of reactive governments. That's not the kind of government that Ulster County is. We are proactive. And because of that, not only have we maintained strong bond ratings and protected taxpayers, but even more importantly, we're designing unique solutions to provide access to care for people in need. And that means all people in need, regardless of their ability to pay. The crises that we are talking about, again, are facing every county. But what I want to talk about today is the crisis facing the world of mental health. The state and federal funding for mental health has dropped by over 50% in the last 4 years. That has moved an enormous burden on local governments, but has not removed in any way, shape, or form the need for this essential service. If anything, it has expanded. And so I tasked the people that stand behind me now with addressing this issue, with addressing a very complex challenge. And when I tasked them with this, I gave them some very clear goals. One, I wanted to make sure that we were able to provide quality care for everyone, regardless of their ability to pay. We wanted to make sure there was a continuity of care for those individuals who are currently receiving mental health treatment so they didn't need to go to new therapists. And last but definitely not least, the goal was to make sure there were no layoffs and to address the anxiety that clearly has existed for a period of time in the mental health department. Because they know well the challenges and the crises that are facing mental health departments all across the state of New York. And so with that, I could not be more proud of the team behind me because they've come forward with a solution. A tremendous, innovative idea that we call the Ulster Cares Initiative. I could not be more proud because they met every single one of those goals, and our taxpayers will be protected, and the citizens in need of services will receive them regardless of their ability to pay. I'm so pleased to say that we have support of both the Community Services Board and Ulster County's largest labor union, CSCA. And so with that, I'd like to introduce Dr. Carol Smith to begin discussing the Ulster Cares Initiative.